more than 100 per minute, it is due to run of premature beat without intervening sinus beat, it is called tachycardia. P or QRS rate more than 100. So I have just given you an example here. You can see the basic rhythm is happening. Suddenly one premature beat is happening here, and this premature beat is actually happening, and it is continued to happen without intervening sinus beat. So this forms a tachycardia. So you can see it is more than 3 per minute. So it is more than 3 per minute running successively without intervening sinus beat. So it is the tachycardia. So tachycardia is the run of premature beats without intervening sinus beat. So this is called tachycardia. So depending upon where they arise from, this can be divided into sinus tachycardia, atrial tachycardia, junctional tachycardia, or ventricular tachycardia. So although we said that there are 4 types of origin, broadly the tachycardias are classified into either narrow QRS complex tachycardia or a wide QRS complex tachycardia. Here the QRS definition is 0.12 second. So whenever the QRS is less than 0.12 second, they are called narrow QRS tachycardia. Whenever the QRS rate of the tachycardia is more than 0.12, they are called wide QRS complex tachycardia. Once again, this narrow QRS and the wide QRS complex tachycardia can be divided into a regular narrow QRS complex tachycardia or an irregular narrow QRS complex tachycardia. So depending upon whether this is regular or irregular, this can be divided into narrow QRS tachycardia, wide QRS tachycardia, regular narrow QRS or irregular narrow QRS, regular wide QRS or irregular wide QRS. So you can look at, there are 4 types of tachycardias we have to see. Today, what we are going to see is narrow QRS complex tachycardia. That means, whenever there is a tachycardia, I look at the QRS duration. If the QRS duration is less than 0.12 second, I call that tachycardia as narrow QRS complex tachycardia. Then I see whether throughout the ECG, the interval between 2 successive R wave is same or different. If the interval between 2 successive R wave is the same throughout the ECG, that the R interval is not changing throughout the ECG, it is called regular narrow QRS complex tachycardia. If the distance or the difference or the distance between 2 R interval is continuously varying throughout the ECG, it is called irregular narrow QRS complex tachycardia. So the 4 examples of the narrow QRS complex tachycardia are: the commonest cause of narrow QRS regular tachycardia is sinus tachycardia. Then you have 2 forms of junctional tachycardia. The junctional tachycardias can be the AV node re-entry or atrioventricular reciprocating. We will come to that little later. So 2 forms of the junctional tachycardia. Then you have an atrial tachycardia. So tachycardia which is arising from the atrium. An extreme form of atrial tachycardia, when your atrial rate is very fast, atrial tachycardia with a very fast atrial rate is called atrial flutter. So the atrial flutter will come into regular tachycardia as well as irregular tachycardia, because it all depends upon how the AV node is going to conduct these flutter waves. If the AV node is conducting regularly these flutter waves, for example, every 4th beat it is conducting, every 4th P wave it is conducting